I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on cloudy cornea, what can I do? Well, just to remind you, the cornea is at the front of the eye, you can touch it, and that front of the eye, it's the first lens of the eye, the most important lens of the eye, and the most powerful lens of the eye. Unfortunately, there are conditions where it swells, and when it swells, it goes cloudy. And when it goes cloudy, you don't see so well. Now, it'd be simple to say that it can happen suddenly and you would lose vision, and of course then you get it checked, but it doesn't. It happens very slowly. Not only does it happen slowly, it fluctuates. So sometimes people think they're actually imagining it. Typically it happens in one eye first, so it doesn't happen both eyes together, it happens in one eye first. So let's say it happens to my left eye. The pattern is this: you wake up in the morning, it's a bit blurry, and then it clears. And then sometimes later it's a bit blurry, it takes longer to clear. And then it fluctuates, and then it's better, and you think it's all good, and then it starts to be persistent. So what can you do? Well, what most people do is simply this. They change what they do. They change their environment, they change their driving, they change their reading, and they slowly withdraw as their vision deteriorates. But there are other things. You can see your eye doctor or your optometrist and ask them for drops, not just lubrication drops, but sometimes some steroid drops will reduce the swelling of the cornea, and sometimes drops to lower the pressure of the eye will reduce the swelling. Your optometrist or eye doctor will give you those, and they can help. The natural history, however, is slow, progressive deterioration. So what you can do is plan. Make sure people around you know, make sure your other eye is seeing as best it can. Ultimately, it can then progress towards pain. Well, you don't want to really get to that level, that's quite advanced. But really, if you can get it to the point where you can cope for a couple of hours a day with blurring vision, you're not going to compromise the eye. One final tip is sometimes putting a cream in the eye at night time when you go to sleep can reduce the sensation of blurring in the morning. Please note, all of these things are band-aid recommendations. They're not going to stop you getting worse, and they're not going to cure you, but they will help you get through that time. Eventually, as the cell failure progresses, you will need surgery, and that's the subject of my next video on when to proceed. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and thanks for watching.